Lillie is our very special little girl. We knew it from the beginning. Her challenges weren't immediate, but by as early as 4 months old, we could see them beginning to emerge. She couldn't sit up on her own until almost a year old, didn't crawl until 15 months old. At 2, she still couldn't talk, and it wasn't until just before her 3rd birthday that Lillie took her first independent steps. Like so many other families of children with special needs, we went through years of countless therapies, doctor's appointments, not to mention a multitude of metabolic tests and genetic tests, all of which came back normal. Clinical diagnoses of Rett syndrome and Angelman syndrome were considered. She had some of the characteristics. She was nonverbal. She still couldn't walk. She had a very happy demeanor and smiled incessantly as a child, but she still didn't quite fit. We received an autism diagnosis along with global developmental delay, which was kind of just a placeholder, as we knew there was something else causing other aspects of Lillie's condition that couldn't be attributed to the autism. In addition to typical symptoms related to autism, such as sensory processing difficulties, anxiety, and speech impairment, Lillie was also experiencing low muscle tone, delayed walking and abnormal gait and coordination, dyspraxia, difficulty eating and gaining weight, and orthopedic problems. She had worn orthotics since she was a year old, and none of this could be linked to autism. We ultimately did whole exome sequencing in 2014, and there were 2 variants found, but they were also found in her father. So it was still uncertain if these were causing her issues or if they were insignificant. So we really still had no answers. And then 2 years later, I opened this letter and read these words describing these sweet girls. And at the end of the letter, there were these photographs. And we just could not believe the similarities in their appearance and their characteristics. We realized we may finally have an answer. And this letter described gene variations on the HNRNPH2 gene. But I had never heard these letters before. These weren't the 2 variants in our file. So we called our geneticist office, and it turns out GeneDx had done a reanalysis of our daughter's whole exome sequencing in 2015, a year after the initial analysis, and found a variation on the HNRNPH2 gene. But at the time, she was the only one in their system with this variation, so it was determined that they didn't know the significance. It was just filed in our geneticist's office, and we were not informed until 2 years later. So we went 2 years thinking that this may come from her father, it may not. We had slipped through the cracks. So now that we have the answer, the HNRNPH2 gene, it was such a long journey to that ultimate diagnosis, 5 long years of searching, and we finally had the answer. And in the years since then, we have learned so much. We've connected with these amazing families who are also touched by this rare disease, and they and the doctors researching it have opened our eyes to so much that we didn't know that could be happening with our daughter. We've been alerted to medical conditions that we didn't know could be a threat. We now monitor for seizures. There were so many things of Lily's condition, like she would just stop in her tracks at a curb or a difference in the walkway, and we couldn't understand why. And now we know, having gotten the correct diagnosis, that cortical visual impairment is part of the disorder caused by HNRNPH2 variation. And so we had that checked out, and lo and behold, that's what's causing a lot of her issues that have been attributed to autism. So we've been able to address those and make adaptations, which has really increased her focus in school and her ability to learn, really opening up her world for her. We were also alerted to other orthopedic problems that we didn't know existed. She'd worn orthotics, but we never knew to have her hips checked. Lo and behold, again, there's another issue that we discovered. She has hip dysplasia. So there were just so many things that we would never have known about had we not received that correct diagnosis. And the connection that we've made with these families, the bonds that we've formed, the scientific networks that we've helped to develop by driving this forward from the parent and patient perspective has just been tremendous in her everyday life. And now we have treatment in sight. I remember when we first got Lily's diagnosis, and we went to the Disorder Film Festival with another HNRNPH2 family, and I our journey to the audience in this way. Before our diagnosis, it was like taking a road trip without having a starting point or an ending point or a roadmap. We were just driving blind. And now we have that starting point and we have friends to share the journey. And we have an endpoint, we have treatment in sight, and none of that would have been known or possible without a correct diagnosis. Don't let yourself slip through the cracks.